going to say a few words about our approach to hair transplant surgery. The first thing is pre-operative evaluation and counseling of the patient. In this situation, we're going to meet the patient and discuss their goals and objectives and do a thorough assessment of the patient. We will also discuss, secondly, then medical treatment, which in my practice is essential to hair restoration surgery. After that, we have to see if the patient qualifies for surgery. So the first thing that comes to mind is the patient's age. Patients under the age of 22, normally I would be more conservative and we put them on a medical treatment program first and see if they can commit to that. Then there is the donor area versus the recipient area ratio, how it looks now and how that projects into the future, very important. Then there is the patient's goals and objectives. They have to be realistic and match the patient's hair characteristics and just be realistic. That's the critical factor there. And then, is the patient committed to taking medical treatment for the rest of their life? That is a critical factor for me. Those are the main points that make me decide if the patient qualifies for surgery. Then we do a more in-depth evaluation of the donor area, the density and the size of the donor area, the calculated density, how many hairs per follicle. Then in-depth discussion about the patient's goals and objectives. Then we have to plan the recipient area, how dense we want to transplant, which areas we want to transplant, and obviously that will have cost factors that impact as well, because it will make us decide how many grafts are going to be transplanted in the end. Then the hairline design. The hairline design is probably the most critical aesthetic aspect of a hair transplant because it is the part of the transplant that is visually catching the eye of any observer firstly. And that has to be natural and it has to be just looking as good as possible. Then there is the planning for future hair loss. I don't know if a patient will commit to the medical treatments, even if they say they do. Maybe a few years down the line they stop taking the medicine, so we have to plan as if the patient is not going to take the medical treatment for the long run. Then there's female pattern hair loss. In females we have a slightly different approach compared to men, because the hair loss pattern is different, the donor area is different, and the medications are different. And yeah, it's a different approach. Then there are non-androgenetic alopecia causes of hair loss. We have to make sure that we are not dealing with one of the other causes of hair loss, like scarring alopecias or systemic illnesses like, say, hypothyroidism, low iron and things like that. Those things have to be sorted out before we can move on to hair transplant surgery, or we have to get a clearance on that at least. Then we have medical clearance for surgery. Medical clearance for surgery would be relevant in older patients, patients on multi-medications, and patients with previous hair transplant surgeries. If patients had a previous hair transplant, it complicates the pending hair transplant, and careful planning needs to be made, and really a decision has to be made if it's possible to actually move on in a meaningful way. Then we also try to prevent shock loss as best possible. Shock loss is the shedding of hair after surgery from the follicles that weren't transplanted, the existing follicles. It's just a stress reaction of the body. It happens in about 10 or 15% of cases on average in the industry. So I follow certain pre-operative protocols, intraoperative protocols, and post-operative protocols to prevent and minimize shock loss. But fortunately, shock loss just about always recovers. In my practice, certainly I've never seen it not recover, and usually after 3 to 5 months, the shock loss is recovered completely. In women, shock loss is much more prevalent, up to 40 to 50% of cases, so this has to be discussed in detail with the patient, and she needs to be made aware of that. And then, if any complications arrive, they have to be treated effectively and efficiently. And that's our approach to hair transplant surgery.